Welcome to the Patient Voice Podcast, a platform dedicated to amplifying the patient voice throughout clinical development.
Hi everyone, and welcome to this episode of our Patient Voice podcast. I'm your host, Naomi Litchfield, Director of Patient Advocacy at Barnacle EMAS, a leading provider of early access programs bringing life-changing medicines to patients around the world. We aim to create a positive patient journey and reduce patient burden. This episode is all about a treating physician's perspective on what it means to collect real-world data at UCL Great Ormond Street Hospital Institute of Child Health in London. I am honoured to be joined by Professor of Paediatric Neuromuscular Disorders, Giovanni Baranello, who is responsible for many research teams, including looking after families participating in early access programs. Giovanni, welcome. I'm so delighted you could join us today. This is an extra special episode to me, as I was once part of the Great Ormond Street Hospital neuromuscular research team, and I still hold the teams, the patients, and the families very close to my heart. So please introduce yourself and tell our listeners about your unique professor journey to date.
Yeah, so I trained in Italy as a pediatric neurologist. I started as a consultant there in a quite large neurology and neuromuscular center. And then in 2019, I decided to embark in this new feast to come over to join the team at the UCL and Great Ormond Street Hospital, the Dubowitz Neuromuscular Center, because, this is a leading center for research in rare diseases, especially in the field of neuromuscular, that has evolved so massively in the last few years with new, treatments available to patients, new clinical trials to treat very rare and severe conditions. So it was a huge jump, but I'm very pleased to be here, working, within this team, in this wonderful, environment, and liaise so much, with families and advocacy groups, patients, and so on.
Oh, amazing. Thank you so much for sharing that. Oh, it's so nostalgic for me.
Yeah.
You're an amazing family. So real world data. So what is your experience of collecting real world data from early access programs? And do you think it's changed a lot since you started at UCL over the last few years? And have you seen many trends change, and what's more common, more uptake of, say, patient reported outcomes and the types of data that you're asked to collect on early access programs?
Yeah. This is, I would say, an increasingly hot topic, because, we are talking about rare diseases. And I think that, the situation in the UK and here at UCL and Great Ormond Street Hospital was really pioneering in this field, because even before there was any, clinical trial or, any opportunity, any new treatments on the site, it was somehow arranged to have these disease registries, particularly for two conditions, spinal muscular atrophy and Duchenne muscular dystrophy, that are, among those that are more common, in our field. And this allowed to collect a lot of real world data when patients comes to clinic. They have the regular, clinical assessment with the doctor, with the physiotherapist, with the respiratory consultant. We managed to collect and update into the registry all these real world data that now we realize are so important to understand, the trajectory of a disease, to benchmark if there is a new therapeutic options, available to patients, to see what is the difference, what really matters to patients, to change their trajectory, their, severity of the condition, and so on.
Yeah, absolutely. Thank you for sharing that. It's fascinating. And I'm just curious of any challenges that you encountered while you've been collecting these different data points, and if the purpose was clear, that you were told by industry of what was going to be done with the data collection, and why you were collecting them. And have you seen much early engagement with companies, with yourself and your team, getting your input for healthcare professionals, but
Yeah.
also for patient advocacy groups as well.
Yeah. So I want to mention, first of all, that, we closely work with the advocacy groups. So they are part of our steering committees. They really regularly drive, let's say, the type of work, that we do, the kind of data that we try to collect and so on. They give us their expert advice, because I think it's very important, because we may have some sort of view what could be important to collect, but then, how this would translate it to, something that is perceived as beneficial to patients really needs to come from them, from the families and the patients themselves. And
Absolutely.
going back to your point, so all these registries, basically, in the vast majority of cases, they started as academic initiatives, supported often by, charities or advocacy groups, and it really was up to the clinicians, to have the motivation to collect, this data and upload this data on top of their clinical duties. So it's really something that should be, acknowledged, and they should be, we should be proud, of all the engagement, of all these clinicians, especially when they are overstretched, there are often small clinical groups, working and dealing with all the routines and so on. So everything started like that, but now there is a lot of
burden.
there's a huge burden, because again you need to often fill in forms, or it's like for clinical trials we have very detailed spreadsheet or CRF, like portals, that we have to fill in, and this is something similar.
Reimbursed for that, but for early access, no.
But here there is no basically additional support, and everything that has been done so far is due to the support of charities or academic initiatives and so on. And this is why, with the increased number of patients, the increased number of assessment and data that we should collect, it's really indispensable to have additional support because this may happen.
Yeah, no, I completely agree. And it's great that you're doing that early engagement with the patient advocacy groups as well.
Yeah.
I think, the industry, the companies that work with you are very fortunate to have that, and you have those relationships and that early engagement. But I suppose for other rare disease pharmaceutical companies that maybe not working in neuromuscular and don't have that insight to the kind of pioneering patient advocacy groups that you have, do you have any suggestions or any other I suppose ideas of things that could be best implemented when collecting real world data on early access programs? Any advice?
So one of the things that we used to say nowadays, to all the the sponsors, the companies that we liaise with, is try to start much in advance the conversation exactly with patients, representatives, advocacy groups, because this is what regulators want to know. They want data, they want information on what really matters to patients. If you have a drug that gives you X% of increase in a certain or improvement of a certain biomarker, the regulators, when it comes to approval and reimbursement, they want to know what is the clinical impact of all these changes, for example, that your drug is providing. So they want to know what is significant, what really matters to patients. So often you have, for example, in the UK, that NICE ask to have, quality of life or patient-reported outcomes.
Yes.
To have this feedback essentially on the utility and usefulness and benefit of a specific drug. And if you start the conversation much in advance, of course, you can come already with a sort of proposal, that, you have a possible strong, PROM or questionnaire or outcome measure that has been developed specifically for that patient population that is able to capture the change with a specific drug.
Yeah.
Because this is what basically the regulators are going to ask the company, during the discussion, during the negotiation of the approval and reimbursement.
Yes. No, I completely agree. And understanding the condition, the burden of that, and the impact, and the impact of the investigational medicine and how that is affecting their daily quality of life. So early engagement, absolutely. And then with the data collection, just ensuring that the data points are meaningful.
Especially because these are small groups of patients, very limited numbers. So it's very important to have, something that really matters to these specific populations.
Yeah.
And
And you have registries that you have then used with companies to collect data as well.
Yeah, definitely. What regulators want is contemporary data, real world data, benchmark data, data from the patients in that specific country. And they don't have it. They have the data from the clinical trial, often without a placebo group, They use sometimes historical controls that are not necessarily contemporary controls or contemporary real-world data. And this poses an issue, like a challenge for a potential approval and reimbursement. This is why it's important, to support the collection of the real-world data, even at the stage of expanded access programs, because you may have basically the possibility to collect long-term safety, efficacy data, especially because often, in rare disease, it's very hard to see a massive change in a double-blind placebo-controlled trial, often, a few months over a few months. We have seen this recently, trials failing to meet the primary endpoint, but nevertheless showing some signal, of improvement. And the possibility to use registries, to collect the data in the patients who are receiving the medication through EAP programs, allows the companies, allows the regulators to have a clearer pictures on the long-term, effects of this drug. And also, because it allows the possibility to compare with contemporary untreated patients, how they benchmark, with those who are receiving the treatment.
Absolutely. And personally, we always end our podcast with what is your why? So is there anything else that you can add to why you would, as a clinician, collect real world data? Why is that important to you personally?
I would say, I would mention essentially two reasons. One is we all want, I'm a curious person. I want to learn, I'm a researcher, I'm a clinical academic. I want to know if the drug that I have the possibility to prescribe to my patient is really working and is really giving a benefit to my patient and is also really safe for them. So often, we have, as I said, the possibility to provide, these drugs through these early access programs. But it's important to collect the data because we still don't know actually the long-term effects of those drugs. So this is where, collecting the real-world data play an important role. And the second thing is, for, again, the scientific and research reason, essentially it allows us to really understand, what is changing, what additional things we should be doing to improve, the effects and the disease trajectory of these patients. There is still a lot of that we don't know in our conditions, in the conditions that we treat. So this is why, I think what drives me, in pushing, and trying to implement, this real world data collection. And
Amazing.
and the good thing, for example, in our registries is that nearly, everyone who has a specific query, a specific scientific question can access, can inquiry, can audit, there is a very good and very standardized approach. You can submit a request. There is a steering committee that assess, the rationale of your request and so on, and it's really democratic. The use of these data that is really focused on delivering what is meaningful to patients and to all the community.
Yeah, the whole community, and not just for now, but forward to future patients and families.
Yeah, definitely.
So thank you so much for your time today. I really appreciate it. I know it's precious, especially after clinic and a crazy busy day. Get your stripy socks out for the Red of These Day tomorrow. Send me a picture, and have a lovely evening. And thanks so much for your time. It's great to chat to you.
Thank you.
See you next time.
Thank you for listening to today's episode. If you have any questions or feedback for Bionicle EMAS or any of today's speakers, then we'd love to hear from you. Please get in touch by emailing thepatientvoice@bionicleemas.com. We look forward to welcoming you back to our next episode. Stay tuned.